The World Health Organization warned that preventing children from taking vaccine in Yemen caused increasing cases of tropical diseases among children. According to the latest statistics, more than 24,000 cases have been recorded, especially in the Houthi-controlled areas. This report has more.
While the number of those affected by the floods rose to 300,000 people, the World Health Organization counted 24,000 cases of fever during the first quarter of this year as a result of the cessation of periodic vaccination campaigns, which is a decision taken by the Houthis since the corona pandemic, and their incitement of the population through the media and mosques to refuse to vaccinate children under the pretext of Western conspiracy. In recent data distributed by the United Nations Office for Humanitarian Affairs in Yemen, most of the controlled areas by the Houthis ranked first in the number of affected people, with a total of more than 193,000 people. The city of Aden came in the second place in terms of the number of affected people, who numbered more than 84,000 people. Then Eb Governorate, while the rest of the affected people were distributed in Sana'a and Sada Governorate. The United Nations confirmed that the gap in the humanitarian response to those affected by the floods was large, ranging between 60 and 96%, with a total average of 72%, and non-food items and emergency shelter constitute most of the needs of those affected. The latest report of the World Health Organization monitored more than 23,000 cases of fevers and viruses associated with poor vaccination campaigns during the first quarter of this year, in addition to 2,080 suspected cases of cholera, and the actual numbers are likely to be much higher. The report of the European Commission for Civil Protection warned of diseases associated with low vaccination coverage in children, especially measles cases, which recorded a sharp increase, and said that the majority of patients who were treated for measles were children under the age of 4 years. The European Commission stated that there is a significant increase in malnutrition cases in Yemen in the coming month due to the continued worsening of food insecurity, poor health services, and humanitarian funding gaps.